Harvey, let's move into our Working on Wellness segment today. Working on Wellness is a segment where we partner with the Franklin County Health Department and aim to educate our viewers on a different subject in public health field and how it affects fellow Kentuckians. And today, our guest is Jimmy Chadwell with Voices of Hope in Lexington. Welcome to the show, Jimmy.
Hey guys, thanks for having me.
Yeah, thanks for being here. We're so glad to have you. Let's tell our viewers here, again, we're working on wellness with the Franklin County Health Department, but let's remind our viewers, tell them what Voices of Hope is.
Voices of Hope is a recovery community center. It's based in Lexington, Kentucky, and we partner with the University of Kentucky Healing Community Study to serve different counties in the area. And the goal of the Healing Community Study, the overall goal is to reduce overdose deaths by 40% over the course of the study through the counties they serve.
So where you it's the Voices of Hope in Lexington, but we're here in Franklin County. You guys are working with the health department. So where are you all located here locally?
I'm actually placed at the Franklin County Health Department Syringe Exchange Program at 100 Glens Creek Road here in Frankfort. We're open from 12 p.m. to 3 p.m. Monday through Friday. And if you come around the back of the health department, you'll see a tent. And if you walk through the tent, you'll see a window, and you'll see me there from 12 to 3 with my colleagues Marie Winfrey and Jason Ray. Jason's a health education coordinator. Marie is a syringe exchange program coordinator. And I'm a lead recovery coach with Voices of Hope and also an adult peer support specialist.
So, Jimmy, explain to us how your services work there with Voices of Hope.
Okay. So basically, if someone comes to the syringe exchange program, we offer recovery support services and recovery coaching services, which would help an individual that uses drugs or suffers from addiction to build their recovery capital. Those recovery support services may look like daily and weekly calls to check and see how the individual's recovery is going, linkage to medications for opioid use disorder like buprenorphine, methadone, naltrexone. You may have heard naltrexone referred to as Vivitrol. It's a monthly injection that blocks the opioid receptor and reduces cravings. We also connect participants to residential treatment options like 30-day inpatient treatment, detox services, etc. And also, a lot of what I do individually is connect participants to resources that can help with their recovery journey. So, for instance, if a participant comes to the syringe exchange program and they're a person that is currently experiencing homelessness, we can connect them with community resources such as the Franklin County Women's Shelter, the Simon House Emergency Shelter, or Access Men's Shelter. We can actually give them a housing application to apply for income-based housing. If another individual came with a transportation barrier, we have bus passes available at the syringe exchange program that are provided for by the Healing Community Study as well. We have food resources from the Mission Baptist Clinic, which includes bags of food, food vouchers for $75 to the local Save-A-Lot here in Frankfort. We actually have cell phones at times with 2 months of free service. So if an individual has the barrier of communication to continue their recovery journey, we can provide them with a cell phone with 2 months of free service that's paid for by our grant, so they can communicate with their sponsor if they're in a 12-step fellowship, communicate with me as their recovery coach or one of my colleagues, their family, really whatever they need to get their recovery journey started. We have something called a barrier relief program where we can try to alleviate any miscellaneous barrier that might come up for the participant. So for instance, yesterday I had a participant that didn't have money to get a driver's license that was seeking employment. And without a driver's license, we all know a lot of times you can't get hired on for a job if you don't have that identification. So we were able to give him the funding via our barrier relief program to purchase the ID so he can move on with this process of obtaining employment.
That's amazing. So many just vital resources there. And Jimmy, you mentioned healing communities study, which we'll wrap back around to. We'll put a pin in that. But I really like what you said about aiding in the recovery journey, right? Because it is a journey. It's not a flip a switch and you're in recovery, right? Or you are recovered, so to speak. It's a journey, and I think having folks like you as a resource for individuals is just so huge, because I think it provides that accountability too, right?
Absolutely.
Yeah.
It definitely does. That's part of what the daily and weekly phone calls consist of.
Yeah.
Because I know when I was early on in recovery, being a person in recovery myself, Voices of Hope called me before I ever started working for them, when they were early on in their in the beginning of the organization.
Mm-hmm.
And just having that weekly call for someone to say, hey, how's your recovery going? It reminds you that you're suffering from a disease that's often fatal, and it reminds you the seriousness of it, that a complete stranger would call me and ask how my recovery's going.
Yeah.
I also wanted to highlight harm reduction. Harm reduction is a term that you probably heard in the news a lot lately, on social media. And harm reduction, to me, for me to really completely understand what it was and the need for it, I had to understand how it applied to the community as a whole. So someone who doesn't use drugs may use harm reduction in a manner such as applying chapstick to their lips to keep them from being chapped, sunscreen to their skin to prevent a sunburn. When on the other side of the coin, someone who does use drugs may use harm reduction in a manner that consists of having Narcan available to reduce an overdose, or to have sanitary using supplies to reduce the transmission of HIV, hepatitis C, and reduce the risk of infection as well. So it's really important for us to support these harm reduction efforts. We also have Narcan available, and obviously safe using supplies as well at the syringe exchange program, because if we don't help the individual stay alive, then they don't have the opportunity to get into recovery, and for us to provide them those recovery resources, because without Narcan and harm reduction, they won't be alive to access the resources.
And we actually had Marie Winfrey on a couple weeks ago from the health department talking about the harm reduction syringe exchange program. Yeah, so we loved having her here.
Yeah, and I mean, something that Marie talked about and you touched on, Jimmy, was how gaining the trust of the folks, right, really helps then be able to bring them along the journey to get help with other things, and really then they start to trust the people there to help make sure that they're looking out for their best interest, right? And do you see that every day when you talk to these guys, talk to these folks as they're going through their journey?
Absolutely. Oftentimes they ask for me individually because they know that I'm in recovery. I try to make that one of the first things that I try to get across to them, because it's an easier way for them to build rapport, because they know that I've been through the same experience that they have. Mm-hmm. And that I'm on the other side of it now. I can just easily be in their position as well, but it's a lot easier for them to build trust and ask me for the resources they need. They don't feel as embarrassed because they know that I've been there myself. So I think it adds a little bit of approachability that wouldn't otherwise be there if I wasn't a person in recovery myself too. So.
Well, Jimmy, you mentioned it earlier. We wanted to wrap back around to it. The Healing Communities study. What is that? And what's the overall goal of the study?
Right. So the University of Kentucky Healing Community Study is we're actually in wave one of the study right now. We've partnered with them at Voices with the University of Kentucky to implement the study, and the overall goal of the study is to reduce overdoses by 40% over the course of the study in the counties that we serve. We're starting to plan wave two, so we'll be in 8 different counties. We're currently in the first 8 counties now, and then once wave two starts, we'll be in a separate set of counties.
Yeah. Okay. And we've been talking about it. Again, we've got Jimmy Chadwell here with Voices of Hope. We've been talking about the impacts that you've seen really in this program. Just further expand on that, if you don't mind. Okay.
So we've had the opportunity to sign up 113 participants since last February at the syringe exchange program. Upwards towards 20 of them have had 30-day or longer success in the treatment that we've linked them to. And we've even had a few that have had months of continued and still have continued meaningful recovery since linking them and communicating with them and trying to build the recovery capital. So we're definitely proud of that. All of the resources that we mentioned too, it really takes all of that in a comprehensive approach to help the individual achieve that state. So we're definitely proud of those people that have achieved sustained recovery since being linked.
Yeah, you should be. Yeah, it's just excellent.
Yeah, you talked about, it sounds like a lot of community partners, right, that are helping with resources or things. How, if somebody out there is watching that is either part of a group that might be able to provide help, or they just individually want to help, what would be, how could they get involved?
Absolutely. We have a lot of volunteer opportunities, especially in Lexington, where Voices of Hope is primarily based in Lexington. If you would like to volunteer or help out with any of our efforts, you can visit our website. It's www.voicesofhopelex.org. Or you can reach out to me personally on my work cell. It's 859-684-2338. If you were interested in something more Franklin County centered, I would be the one to reach out to. So feel free to give us a call. Check out our website. We also offer a lot of different recovery meetings, smart recovery meetings in Franklin County that are on Thursdays at 7 p.m. Those are available exclusively virtually for now. All of the links to access those are on the website at voicesofhopelex.org.
Awesome. Jimmy Chadwell with Voices of Hope, thank you so much for coming on the show today and talking about this vital program serving Franklin County and Lexington. Thank you so much for being on, Jimmy.
Thanks for having me.